If you have diabetes and you go to sleep every night thinking you are doing everything right, this might be the one thing you are missing that silently damages your body while you sleep, and almost no one talks about it clearly. What happens in your body at night can either stabilize your blood sugar or push it into dangerous territory without you even realizing it. Many people wake up feeling tired, confused, or unusually hungry, and never connect it to what happened hours earlier while they were asleep. This is not just about food or medicine, it is about a chain reaction inside your body that starts before you even close your eyes. If you ignore it, over time it can affect your heart, your kidneys, your nerves, your vision, and even your brain. But if you understand it and take simple steps, you can protect yourself in a powerful way. Let me explain something most people overlook. When you sleep, your body does not simply shut down, it becomes highly active internally. Hormones shift, your liver releases glucose, your cells repair themselves, and your brain resets signals. For someone without diabetes, the body adjusts naturally, but for someone with diabetes, these processes can become unbalanced. Blood sugar can drop too low or rise too high, and both are dangerous in different ways. I remember a patient who came in complaining that he felt weak every morning. He said he followed his diet, took his medication, and avoided sugar. Still, he felt worse instead of better. When we looked deeper, the issue was not during the day, it was at night. His blood sugar was dropping too low while he slept, and then his body was overcompensating, pushing it too high by morning. He had no idea because he never checked his levels during the night. This is something many people do not realize. Nighttime blood sugar swings are common, and they can go unnoticed for years. Some people even believe that if their morning sugar is high, they should reduce food further, but that can make things worse if the real issue is a nighttime drop. Your body has a built-in defense system. When blood sugar drops too low, it releases stress hormones like adrenaline and cortisol. These hormones signal your liver to release stored glucose. It is a survival mechanism. But in people with diabetes, this response can overshoot, causing high sugar levels in the morning. This is sometimes mistaken for poor control, when in reality, it is the body reacting to a hidden problem. Now think about your typical evening routine. Maybe you eat dinner, take your medication, watch something on your phone, and then go to bed. But what you eat, when you eat, and how your body responds all matter deeply. A heavy carbohydrate meal late at night can spike your sugar, while skipping meals or eating too little can cause it to drop later. Even the timing of your medication plays a critical role. There was another case, a woman in her early 50s, very disciplined with her diet. She avoided sweets completely, but she had a habit of skipping dinner because she thought it would help control her sugar. Instead, she would wake up shaky, sweating, and anxious in the middle of the night. Her blood sugar was dropping dangerously low. Once she adjusted her evening routine with a balanced, light meal, her symptoms improved dramatically. The key here is balance, not extreme restriction. Your body needs steady energy through the night, especially if you are on medication that lowers blood sugar. Without that balance, you risk both highs and lows. Let us talk about something else that often gets ignored: dehydration. Many people do not drink enough water in the evening because they want to avoid waking up at night. But dehydration can concentrate your blood sugar, making it appear higher than it actually is. It also affects kidney function, which is already under strain in diabetes. A simple habit like proper hydration can make a meaningful difference. Sleep quality is another major factor. Poor sleep increases insulin resistance. That means your body becomes less effective at using insulin, even if you are taking medication. If you are staying up late, using screens, or dealing with stress, your sleep may not be as restorative as you think. Over time, this can lead to consistently higher blood sugar levels. I have seen patients who improve their sugar levels not by changing medication, but by fixing their sleep routine. Going to bed at the same time, reducing screen exposure, and creating a calm environment can help your body regulate itself better. Now let me tell you about a pattern that is extremely common but rarely discussed openly. Some people experience what is called the dawn effect. Early in the morning, usually between 3 and 6 a.m., the body releases hormones that prepare you to wake up. These hormones can raise blood sugar. For someone without diabetes, insulin adjusts automatically. But in diabetes, this can lead to high morning readings, even if everything seemed fine before bed. Understanding whether your morning high sugar is due to the dawn effect or a nighttime drop is crucial. The approach to managing each is different. This is why occasional nighttime monitoring can provide valuable insight. Another important point is medication timing. Many people take their medication at fixed times without considering how it interacts with their meals and sleep. Some medications peak during the night, increasing the risk of low sugar. Others may not last long enough, allowing sugar to rise. Adjusting timing under proper guidance can help stabilize levels. Physical activity also plays a role. Exercising too late at night can sometimes lower blood sugar during sleep, especially if it is intense. On the other hand, moderate activity earlier in the day can improve overall control. It is about understanding how your body responds and finding a rhythm that works for you. Let me share something simple but powerful. Before going to bed, take a moment to check how you feel. Are you unusually hungry, tired, or restless? These can be subtle signs of imbalance. Checking your blood sugar occasionally at night, especially if you feel symptoms, can reveal patterns you might otherwise miss. Snacking before bed is often misunderstood. It is not about eating anything, but about choosing the right type of snack if needed. A small combination of protein and complex carbohydrates can help maintain stable sugar levels overnight. But this is not for everyone, and it depends on your individual situation. Stress is another hidden factor. Even if you are lying in bed, your mind may still be active. Stress hormones can raise blood sugar levels. Practicing relaxation techniques, even something as simple as deep breathing, can help calm your system. There was a man who struggled with high morning sugar for years. He tried different diets, medications, and routines. What finally made a difference was managing his stress. He started spending a few minutes each night in quiet reflection, slowing his breathing, and disconnecting from worries. Over time, his readings improved. It shows how interconnected everything is. Diabetes is not just about sugar, it is about the whole body and mind working together. Another overlooked aspect is foot care at night. Many people ignore their feet, but nerve damage can develop slowly. Checking your feet before bed, keeping them clean and moisturized, and noticing any changes can prevent serious complications. Also, avoid going to bed immediately after eating. Give your body some time to process the meal. A short walk after dinner can help your body use glucose more effectively and reduce spikes. Light exposure matters too. Bright artificial light at night can disrupt your internal clock. Keeping your environment dim and calm signals your body to prepare for rest, which supports better metabolic balance. Your sleeping position and comfort also affect your rest quality. If you are uncomfortable, your sleep may be fragmented, even if you do not fully wake up. Over time, this can impact your overall health and sugar control. Let me bring you back to the main point. What happens before and during your sleep has a direct impact on your diabetes. Ignoring this period is like ignoring half the day. You may be doing everything right during daylight hours, but if your nighttime routine is off, you may not see the results you expect. Small changes can make a big difference. Consistency in timing, balanced meals, proper hydration, stress management, and awareness of your body's signals all contribute to better control. And most importantly, do not assume that feeling fine means everything is fine. Many changes happen silently. Being aware and proactive can protect you from long-term complications. There is always a pattern behind every symptom. The key is to observe, understand, and adjust. Your body is constantly communicating with you, even while you sleep, and learning to listen can change everything. As you begin to pay closer attention to your nights, you will start noticing patterns that were always there but never fully understood. Maybe you wake up at the same time every night without knowing why, or you feel unusually thirsty in the morning, or your mouth feels dry, or you have a slight headache that you brush off as normal. These are not random signals. Your body is trying to tell you something important, and ignoring these small signs often leads to bigger problems later. One of the most powerful habits you can develop is awareness without fear. Many people become anxious when they think about their blood sugar, especially at night. They worry that something might go wrong while they are asleep. But fear does not help control diabetes, understanding does. When you learn what is happening inside your body, you replace fear with clarity, and that clarity allows you to take calm, effective action. Let us talk about nighttime hypoglycemia, which means low blood sugar during sleep. This can be dangerous because you may not fully wake up to recognize it. Some people experience vivid dreams, sweating, a racing heart, or even wake up feeling disoriented. In severe cases, it can go unnoticed. This is why recognizing risk factors is so important. If you take insulin or certain medications, skip meals, or have been more physically active than usual, your risk increases. There was a case where someone thought their nightmares were due to stress, but it turned out their blood sugar was dropping every night. Once they adjusted their evening routine and monitored their levels more carefully, those episodes disappeared. This shows how symptoms can sometimes appear in unexpected ways. On the other side, high blood sugar during the night can be just as harmful, even though it may not feel as dramatic. When your blood sugar stays elevated for hours, it causes ongoing stress to your blood vessels. Over time, this contributes to complications that develop quietly. You may not feel it immediately, but the damage accumulates slowly. Now consider your dinner choices more carefully. It is not just about avoiding sugar. It is about understanding how different foods affect your body over time. Refined carbohydrates can cause a rapid rise and fall in blood sugar. Heavy, oily meals can slow digestion and keep sugar levels elevated longer than expected. Even foods that seem healthy can have different effects depending on portion size and timing. A balanced evening meal should include protein, fiber, and healthy fats in the right proportions. This helps slow the release of glucose into your bloodstream and provides steady energy throughout the night. Eating too little can be just as problematic as eating too much. Your body needs stability, not extremes. Timing matters just as much as content. Eating very late at night gives your body less time to process food before sleep. This can lead to higher sugar levels during the early part of the night. On the other hand, eating too early and then going many hours without food may increase the risk of a drop later. Another key factor that often gets overlooked is the role of the liver. Your liver stores glucose and releases it when your body needs energy. During the night, especially in the early morning hours, the liver becomes more active. In people with diabetes, this process can become unregulated, leading to unexpected rises in blood sugar. Understanding this helps explain why sometimes your readings do not match your expectations. You might think you did everything right, but your body has its own internal processes that need to be managed as well. Let us also consider the impact of medications more deeply. Some medications are designed to work over a long period, while others act more quickly. If the timing does not match your body's needs, you may experience fluctuations. This is why it is important to regularly review your routine and make adjustments when necessary. There was a person who kept increasing their medication dose because their morning sugar was high. But the real issue was not the dose, it was the timing. Once that was corrected, their levels became more stable, without increasing the amount of medication. Now think about your evening habits beyond food and medicine. What do you do in the last hour before sleep? Are you scrolling on your phone, watching intense content, or dealing with stressful thoughts? All of these can stimulate your brain and affect hormone levels. This in turn can influence your blood sugar. Creating a calm and consistent pre-sleep routine can have a surprisingly strong effect. Dimming the lights, reducing noise, and allowing your mind to slow down sends a signal to your body that it is time to rest. This helps regulate hormones that play a role in blood sugar control. Breathing exercises are simple but effective. Slow, deep breathing can activate your body's relaxation response. This reduces stress hormones and supports better metabolic balance. Even a few minutes each night can make a difference over time. Let us talk about hydration again, but from a different angle. Drinking too much fluid right before bed may disrupt your sleep, but not drinking enough throughout the day can lead to problems at night. The goal is to stay well hydrated during the day and have a moderate intake in the evening. This helps maintain balance without causing frequent awakenings. Another important aspect is temperature. Your sleeping environment should be comfortable, not too hot or too cold. Extreme temperatures can disturb your sleep and indirectly affect your blood sugar. A stable environment supports deeper, more restorative rest. Pay attention to how you feel when you wake up. This is one of the most valuable indicators of what happened during the night. Do you feel refreshed or exhausted? Are you calm or irritable? These feelings provide clues about your internal balance. Some people find it helpful to keep a simple record of their evening routine and morning symptoms. Over time, patterns begin to emerge. You might notice that certain foods, activities, or habits consistently lead to better or worse outcomes. This kind of self-awareness is incredibly powerful. Let me share another real situation. A person noticed that every time they had a late dinner with heavy bread, their morning sugar was higher. When they switched to a lighter meal with more protein and vegetables, their readings improved. It was not about eliminating food, It was about making smarter choices. Consistency is one of the most underrated tools in managing diabetes. Your body responds well to routine. Going to bed and waking up at the same time each day helps regulate your internal clock. This stability supports better hormone balance and more predictable blood sugar levels. Irregular schedules, especially staying up very late or sleeping at different times each day, can disrupt this balance. Over time, this can make diabetes harder to manage, even if everything else seems correct. Now let us address something that many people hesitate to talk about: emotional health. Living with diabetes can be stressful. There may be moments of frustration, worry, or even burnout. These feelings can affect your behavior and your body. Ignoring them does not make them go away. Taking time to acknowledge and manage your emotional well-being is not a luxury, it is part of your health. Talking to someone you trust, engaging in activities you enjoy, or simply allowing yourself to rest mentally can have a positive impact. Another small but important habit is checking your feet and skin before bed. Diabetes can affect circulation and nerve function, making it harder to notice injuries. A quick check can help you catch any issues early and prevent complications. Let us also consider the role of technology. Continuous glucose monitors and smart devices can provide valuable insights into your nighttime patterns. While not everyone has access to these tools, for those who do, they can reveal trends that are otherwise invisible. However, even without advanced technology, you can still learn a lot by observing your body and making thoughtful adjustments. The goal is not perfection, but progress. Now imagine your night as a carefully managed process rather than an afterthought. From your dinner choices to your mental state, from your hydration to your sleep environment, each element plays a role. When these elements are aligned, your body can function more smoothly. There is a sense of control that comes from understanding these details. Instead of reacting to problems after they occur, you begin to prevent them before they happen. This shift in approach can make a significant difference in your long-term health. Another thing to keep in mind is that what works for one person may not work for another. Your body is unique. Factors like age, medication, activity level, and overall health all influence how you respond. This is why personal observation and adjustment are so important. If you notice unusual patterns, do not ignore them. Take note and consider what might be causing them. Sometimes the answer is simple, and small changes can lead to meaningful improvements. Let us go deeper into the idea of balance. Your body is constantly trying to maintain equilibrium. Blood sugar is just one part of a complex system. When you support your body through consistent habits, proper nutrition, and adequate rest, you help it maintain that balance more effectively. There is no single solution that fixes everything overnight. It is the combination of small, consistent actions that leads to lasting results. Each night is an opportunity to support your health, and each morning is a reflection of what happened during those hours. As you continue to learn and apply these principles, you may find that your confidence grows. You begin to trust your ability to manage your condition. This confidence reduces stress, which in turn supports better outcomes. The connection between mind and body is powerful. When you feel in control and informed, your body responds positively. This is not just about numbers on a meter, it is about overall well-being. And as you move forward, remember that every improvement, no matter how small, matters. Even slight changes in your routine can lead to better stability over time. The key is to stay consistent, stay aware, and continue learning from your own experience. Because what you do before sleep is not just a routine, it is a critical part of your health journey, and understanding it fully can change the way you live with diabetes every single day. At the end of the day, managing diabetes is not about chasing perfect numbers. It is about building a system that works for your life, especially during the hours when you are not even aware of what your body is doing. Nighttime is not a passive period. It is one of the most important phases where your body either heals or struggles silently. When you begin to respect this time and make small, intentional changes, you give your body the support it has been waiting for. What truly makes the difference is not one big action, but the consistency of many small ones, done every night without fail. Listening to your body, adjusting your habits, and staying aware of patterns will always take you further than guesswork or extremes. You do not need complicated solutions. You need clarity, patience, and discipline. And once you understand how your nights shape your mornings, you will never look at your routine the same way again, because real control begins when you take charge of what happens before you fall asleep.